new COVID-19 variant has been detected in the country on the same day that 500,000 new infections were logged. A health expert says the new variant has several mutations that may increase transmissibility and evade one's immune response. In light of these developments, the National Task Force Against COVID-19 assures the public that they will revisit some of their strategies. The Comelec says the plebiscite in Palawan, which may lead to the division of the province, appears to go smooth so far. And a Filipino artist is turning trash into art to inspire people to rethink how they generate or get rid of plastic waste. Fast, focused, and fearless, here's a roundup of stories we're watching now. I'm Riza Diaz. The Philippines is seeing a continuous increase in COVID-19 cases with 5,000 fresh infections recorded just today. Let's talk about this with Dr. Ronchin Solante, head of San Lazaro Hospital's Infectious Disease Department. Doc, good evening.
Good evening, Riza.
Thank you for joining us. First off, Doc, what's your reaction to another record-high daily COVID-19 case today?
Well, it's sad to hear that our cases is really increasing, for the past week. And there are a lot of factors to consider here, but I think it boils down again to the way how we implement or how we follow the minimum health safety protocol at this point in time. Plus the fact maybe there is already a contribution, these new variants that are already in the local level of transmission, like the B117, the B1351, although in the surveillance, the numbers are still very low, but quite difficult to say that this is primarily secondary to the variant. But I would also say that more or less it's still because of the non-adherence or not strictly adhering to the minimum health safety protocol.
Sir Doc, is it safe to say that the new variants and mutations of concern are directly linked to the spike in infections?
It's difficult, Riza, no? Kasi if you look at the number of the cases confirmed with this new variant, napakababa pa ng mga nakikita natin, no? Like for example, the B117, no? More or less 117, something like that. And then yung South African variant, which is the highly transmissible variant, we only have like 90 cases, no? So siguro we'll wait for the further analysis of the surveillance kung talagang this is already widespread, and more or less we can totally say na an important factor here is really the presence of this variant.
Sir, what could possibly be the impact of the increasing number of new variant cases, lalo na po sa mga ospitals across the country?
Malaking impact siya, no? Kasi unang-una, pag dumadami ang cases, pero di ba sabi natin, based on the current data, 80% of the cases are still in the mild form, no? And the remaining are moderate, and those that are admitted are usually the severe and critical. So ang binabantayan natin dito, yung mapuno yung health facility, especially the intensive care unit, kasi ito lang yung area na maalagaan natin itong mga severe and critical. So if there will be more patients in the severe and critical, then meron yan siyang implications doon sa resources ng mga hospitals, especially the healthcare workers working in these facilities.
Doc, there in San Lazaro Hospital, how is the situation like in terms of occupancy?
We're still okay. We're not overwhelmed yet with a lot of these cases, no? And in fact, our latest report, based on the department that when I was daily looking at the cases, we are more or less 58 to 60% capacity among our COVID beds, but our ICU beds is already full. So most of the patients that are critical, which will be in the ICU, somehow it's difficult for us to accommodate more severe critical cases.
Dr. Ronchin, finally, LGUs are saying that they're seeing a surge in household infections. What do you think are the most effective ways to mitigate this?
Yes, it's important because I think there is a factor here of the household transmission. No? Nagkakahawaan yung mga magkapatid, tapos napunta doon sa mga parents nila that are vulnerable. And I think it's really important that we still have to extend our minimum health protocol that should be observed also sa bahay. No? Ang nangyayari kasi dito ngayon, ang mga matanda na nahawaan, sila yung nagiging severe and critical. Sila yung kakaawa-awa. No? So we have to implement that, and I hope the LGU can also strictly do their thing in terms of the compliance of this health protocol within the houses. No? But it's a challenge. It's really very difficult to do that also.
Thank you for your time and your insights, Doc Ronchin Solante. The Health Department confirmed earlier today a new variant that first emerged in the Philippines. Speaking to us earlier, Dr. Eva de la Paz of the UP National Institute of Health explained that the new variant, known as P3, has a combination of mutations. These mutations are also seen in other variants of concern. De la Paz added that the P3 variant also belongs to the same lineage as the P1 or Brazilian variant. The DOH has also confirmed today the country's first case of the Brazilian variant.
It does have the N501 at saka yung E484K mutation, plus the P681H na sinabi ko, which are presumed to be involved in infectivity. Di ba nakaka-increase ng transmissibility, tapos yung N501Y, yung E484T mutation naman, nakita na parang it can evade the host immune response.
Now, as COVID-19 infections continue to rise, the National Task Force Against COVID-19 says they are now revisiting the protocols to combat the virus more effectively. NTF COVID-19 spokesperson General Restituto Padilla told One News that a huge chunk of these efforts lie on boosting the contact tracing, which he said is often ignored.
We really need to strengthen contact tracing, but we do understand that a lot of LGUs have taken a slack or slacken up a little bit on contact tracing. So we need to reinforce all of these measures that we have implemented last year and probably reinforce and not only reinforce it, but strengthen it further in light of these new cases that are coming and the mutations that we are closely following.
Now, when asked if the government is eyeing to impose lockdowns on a wider scale, Padilla said it is not an option. He added that it's best if they would stick with its hammer and dance strategy, but if LGUs prefer to conduct their own lockdown, they have the liberty to do so.
The easing is to give way to the hammer and dance strategy of government and allow for a delicate balancing act between the re-energization of the economy as well as the protection of public health.
We'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. There have been no irregularities in today's plebiscite that would decide whether Palawan is to be divided into 3 provinces. Comelec Commissioner Antonio Co, however, says that the proclamation of the result may be delayed due to a heavy downpour. Palawan residents are voting to decide whether the country's largest island province will be split into Palawan del Norte, Palawan Oriental, and Palawan del Sur. Comelec earlier said they see the Palawan plebiscite as preparation for next year's national elections amid the pandemic. Senator Manny Pacquiao refuses to talk about political ambitions now, noting that the presidency is appointed by God. In an interview with 1PH, the Dean Mel show, Pacquiao said he is still focused on helping people out amid the COVID-19 pandemic. Pacquiao explained that while many have attempted to run, only those who are destined to be the president have succeeded.
May time tayo dyan na pag-usapan natin yung politika. Kung ano man yung plano ng Panginoon sa atin. Yes. Yung sinasabi mo na sa pagkapangulo, sa presidente, ito lang tandaan sa lahat ng mga nasa sa politika. Walang tao na pwedeng maglagay dyan, kundi ang Panginoon ang naglalagay dyan. Sino yung anointed ng Panginoon, sino yung approved ng Panginoon, yun ang nalalagay dyan.
To quote a Filipino saying, there's money in trash, but for this Filipino artist, it's more than just the money. His love for art cleaned the ocean and launched a global advocacy. Since 2019, 49-year-old Gilbert Angeles has crafted over 2 dozens of paintings, all of them made from shredded plastics and leftover food. Angeles wanted to teach Filipinos that through art, we could save nature and educate the society. His paintings have been featured in international galleries. Some of those sold for up to $3,000. We've got a long way to go, but Angeles believes there's always an avenue to turn trash into something beautiful.
In quarantine. 12 months of battling the coronavirus. 12 months of living in a new normal. This March 14, One News brings together the people who helped shape the way we live in the year of pandemic. How have we managed? What we may have missed? Where are we headed? Some of the country's leading voices in the scientific and business communities face the nation as the Philippines balances public health and economy. Kumusta na ba tayo? A town hall in the time of pandemic. Moderated by Robbie Alampay and Cheryl Cosim. Join us live March 14, Sunday. We are One News.
Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.